So, hello. Thank you, everyone, for being here. Welcome to this press conference about the situation of COVID-19 in Montreal, together with Dr. Mylene Drouin, the Montreal Public Health Executive Director, and, of course, Ms. Valérie Plante, the Mayor of Montreal. I will start by asking journalists who are on their phone with us, please, as always, please mute your phone in order to avoid any sound feedback and the broadcast of, music here. We will start by a speech in French, followed by a speech in English by Madame Mylene Drouin, followed by the same thing by Ms. Valérie Plante, the Mayor of Montreal, and then we will be following by a question period. We'll start with questions in French, followed by questions in English. We will ask journalists to limit themselves to 2 questions, please, not 3. 2. So I repeat, please put yourself on mute. This press conference is being broadcast directly on the Santé Montréal Facebook page. And now, Dr. Mylene Drouin, the Montreal Public Health Executive Director. Hello, everyone. So, right off the bat, it's been a certain time that we haven't done any press conferences about Montreal. We weren't on vacation, of course. We were rather very busy working at being able to give you data, but particularly doing interventions with the establishments following the numerous breakouts that are ongoing in the CHSLDs. So the state of the daily situation for Montreal, 7,281 cases, so that's 451 new cases. That can seem to be a lot. What I wish to mention to you is that in these cases, over 200 cases are what we call catching up in the computer system. So these are cases through link that we call epidemiological. So these are people who were contacts of people who had a lab test and who then developed symptoms either in the family, brothers and sisters, the siblings, but who are already isolated and for whom we did not need to do any lab tests. So that is why they were not integrated automatically in the system since we didn't have a lab test for them. So I'm telling you, in the next few days, we're going to be integrating all of these cases. There's over 600, so it's clear that the curve is going to seem like it's increasing a lot. But the new daily cases, like really recent ones, we are remaining in a plateau. So we continue being very confident that we have reached the peak of the epidemic curve. 25% of our cases are now in the 70 years and over, and that reflects, in part, our screening strategy in which we went to invest a lot in the past few days in CHSLDs and in which there are outbreaks. We have 332 deaths, of which 90 in the past day. And as the Premier said, here too, these are corrections that were added since many of the establishments, CHSLDs or nursing homes, did not necessarily always send the declarations and the death certificates. So we should be updated with all these numbers by tomorrow at the latest. In terms of new admissions, usually I gave you the number of hospitalizations and the number of ICU, intensive care, but now we're really looking at a more reliable, so that's the new admission of serious incidents. So 76 new admissions at the emergency ward and 6 in intensive care. So that is a plateau for intensive care, and we can't quite say yet that we have any kind of lowering in terms of hospitalizations. If we look at the outbreaks, which is what concerns us the most, it's 75% of our CHSLDs in Montreal, so 59 out of 79 that right now have outbreaks. And for the residences for the elderly, it's a lot less. It's 23% of the residences for the elderly. So I know that you wish to have numbers. Our surveillance system is becoming more and more reliable, and we built it. And I ask you to be diligent, or at the very least of accepting that there are some imperfections. We'd love to have all the numbers quickly, but please know that this week we were not following COVID, we weren't following everything that happened in a big region like Montreal. It's over 200 establishments that each have their own data collection systems. So the system was not set up. So we're building it as we speak, and now we're getting to something that is going to be more stable and that will be reflecting the reality, even though there may still be certain imperfections. So as I was saying, we have to put out the fires at the same time as we are creating inquiries. But sometimes, we have to put the priority on the fires and not on the numbers. Today, I'd like to talk to you about an initiative that was done in collaboration with the City of Montreal as well as 211 to be able to have a link with our most vulnerable elderly. So it's initiatives where we've launched automated calls, that are sent out to people 70 and over. So there was a first pilot project with close to 5,000 elderly people in certain territories, and it worked well. So basically, the people receive a message, and we say that it's both the city and public health to capture their needs, and if they do have a need, we call them to call 211. Needs can be food, medication, a need for delivery, or a health need. These are not fraudulent calls, so we ask you to answer, but up until now, what it shows us is that the system is functioning well, and knowing that the elderly are going to be isolated for a certain period still, I think that it is a system that we want to extend to the entire island of Montreal to make sure regularly that our elderly in need be well-oriented and supported. Concerning the integration of caregivers in CHSLDs, so an announcement that was expected, the Premier made it in his press conference the day before yesterday. So we got the general guidelines. You know that Montreal is in a particular situation when I say that 75% of our CHSLDs are in outbreak. So we have to take particular precautions to be able to do this safely. First, a caregiver, let's remember, is a person who is known for having given regular care to a resident, so known by the CHSLD and their administration. It's not a visit. It's really to go give care. So the preparation that will be expected, it's pretty demanding. Training, being able to put on protective material, and as well a consent, because it's not a zero risk to it has to be an informed consent because there is risk. And what we have to understand is that since our CHSLDs are, most of them, in outbreaks, there are a lot of hot zones in which caregivers will not be able to go. And even in a CHSLD that has a majority of hot zones and where an outbreak is uncontrolled, we will not be able to, in the short term, integrate the caregivers without making sure that we have mastered the outbreak. However, the CHSLDs, which we call cold, or in which there are well-controlled cold zones that are well delineated, in those cases we'll be able to, or rather the establishments will be able to progressively integrate the caregivers. This integration, we would like for it to happen as of today, but that won't be possible. Right now, you've been hearing it in the media. We are integrating a lot of new health professionals, doctors, nurses, orderlies who are coming from other establishments. That requires a very significant logistics to prepare, train, make sure that the material is there, and organize that entire integration. So you'll have to be patient for Montreal. It will take a few days. And according to the status of the establishments, you will be informed by the management whether it will be possible or not to integrate caregivers, and of course how you will be prepared. There will be schedules because of course we don't want to have, 80 caregivers to arrive at the same time in one establishment. So all of that will have to be coordinated very minutiously. So I reiterate, we wish for caregivers to come and contribute, and especially come give care to the person that are important to them. But we have to make sure that everything is set up so that it can be done safely. Many are asking us questions on the deconfinement. Deconfinement for a large region, which is the epicenter of Quebec, and not only Quebec but Canada, is something that we must plan correctly because we want a safe deconfinement and prevent the possibility of a second epidemic curve or wave of cases that could surpass or overwhelm the capacity of our health system, which is already quite burdened right now. Montreal has particular characteristics, the density of the population, a great mobility of the population with transportation systems, public transportation, trains, metros that can present challenges, and of course by being the epicenter and having been very affected in public health. We have to take all of these factors into account and make sure that the conditions and what we need to have in place to be able to do that deconfinement safely is done correctly. So right now, we are working together with the different regional public health managements of the Greater Montreal area, as well as the mayors in those regions, in order to be able to look at more specific elements that are specific to our realities that we have to integrate into a deconfinement strategy, and we'll be able to share these measures that are more specific to our own reality. To end with, we've had a lot of questions on everything having to do with community gardens. So very quickly, we'll be able to give you the conditions that will frame the reopening of that kind of service, but in a safe way, because yes, we judge that it is a service that has to do with food safety and which is therefore important for Montrealers. So to end with, of course, we are not letting down our guard. I wish to thank you. Social distancing, even after a great number of weeks, is still being followed. Montrealers are applying the measures of the 2 meters correctly, as well as the hygiene measures. And gradually, of course, I brought a mask, but the recommendation will remain when you go in public places, and that you cannot respect the 2 meter distance, or the conditions don't allow for that to be respected. We encourage people to have something to cover their face, which can be a homemade mask, a scarf, or something of that nature. So that is something that we'll slowly have to integrate in our way of doing things. And to end with, I would like to thank the health networks and my own teams from the regional public health who work at supporting and to try to slow down the progression of this pandemic. A few words in English.
So the Montreal situation as for today, we have 7,281 cases. It's a progression of 451 new cases. But it's important to know that among those new cases, we have 200 cases that are cases that have already been investigated, and that those cases are cases linked epidemiologically to our family members that were contact and that became cases. So we do not have any tests, but we consider them as cases, as confirmed cases. So we're going to see about 600 of those new cases, but that will seem that we have a big progression in the number of total cases, but we still, if we look at the cases today and yesterday, we have attained a plateau. We have 332 deaths and 90 new deaths for today. For the number of admissions, we're looking at the new admissions, hospitalizations. We have 76 yesterday and 6 new admissions in intensive care units. And we're seeing a small progression or tendency to in the rise in the hospitalization, but for intensive care unit, we see a plateau. I know our big concern is the outbreaks that we're seeing in the CHSLD and elders residency. For Montreal, we know that 75% of our residency are now living in outbreak, and for private residency, it's 23% of them who have cases of COVID-19. I wanted to talk today specifically about a project that we have done with the collaboration of the Ville de Montréal and 211, a project to call of automatic calls to all elders of Montreal. We did a pilot project last week, joining more than 5,000 elders. So if you have a call from the City of Montreal or from Direction de Santé Publique asking you if you have any needs, specific needs, food, medication, you need delivery or health problems, and we ask you to call 211 if you have specific needs, and we can refer the elders to community organization or the CLSC to give the services that they need. So this is going to go on for the next couple of weeks, and we're trying to cover all the island of Montreal. Also, the Prime Minister has announced the integration of the caregivers in CHSLD this week. For Montreal, we are in a specific situation. As I said, we have more than 75% of our CHSLD that are in outbreaks. So we cannot do this in the same way as we can do it in other regions where there is no or really low level of cases in CHSLD. When we are talking about a caregiver, it is really a person that is known by the CHSLD to give care regularly to a resident. And this person, if we integrate this person in the CHSLD, we're going to have a good preparation, training, use of protective equipment, and of course a consentment, because it is not a zero risk. It's not zero risk. Of course, the CHSLD that are in active outbreaks and they have hot zones, caregivers won't be allowed to go in those CHSLD or in those zones. For CHSLD that have no outbreaks, that we say they are cold, and in some CHSLD where we have specific cold zones that are really well circonscrits,
or
separated, we will permit that caregiver can come in. And this will be done in a couple of days, because right now the priority is to integrate new healthcare workers that are coming from hospitals and that also need to be prepared. So each CHSLD are going to contact the families and are going to give the recommendation according to their situation. At the end, I just want to finish by saying thank you to Montrealers, because we're still, the distanciation, the respect of the recommendation are well applied. And of course, I want also to say special thanks to all the healthcare workers in CHSLD and to my team that is working hard to prevent more outbreaks in the island of Montreal. Thank you.
So hello, everyone. First, I am very happy to be together with Dr. Drouin, who is giving us an update that we were looking forward to, and I wish to bring my voice to yours concerning the employees of the health network who are doing incredible work, and of course, your own teams that are working so hard. Without waiting, I just want to come back to the project, the telephone calls, the automated calls done to the elderly. That is, in fact, a project that was brought forward together, a teamwork between the City of Montreal and public health. And what I wish to say is to the elderly people listening to us, or perhaps people who have an elderly person around them, is to hear that this call, if it says that it's the City of Montreal and Public Health, is a safe call. It's not a fraudulent call. And we, of course, we invite you to hear the entire message because you'll get all the resources at the end. And of course, I'd like to remind you, any person who feels, elderly people, but any other more vulnerable people, if you have any worries about food safety, medication, access to certain services, we ask you to please call 211. This is a telephone line that is filled with resources. And also these calls, automated calls, will also allow us to document and be able to better target certain approaches with the elderly community. And the news that I wanted to tell you today is one that has to do with transportation. It is concerning the taxi office. So the Bureau de Taxi, the taxi office at the City of Montreal, we decided to work together, and the city is going to give $270,000 in help to allow the taxi industry to adapt itself to the new situation. Of course, it will allow, the first element that comes to mind is, of course, the installment of protective plexiglass that is going to protect the drivers from clients in the car. And we are going to add sanitary products for drivers as well as their clients. It is important for us to support the taxi industry because in the different mobility means that are available to the population, of course, we're talking here about collective transportation, but it can also be bixies, and there's the taxis. And we wish to make sure that whether it be the workers, the drivers, or the population that could use these, that it be safe. So we are very happy with that first project, and I think that will allow the population even more to be able to do these essential movements and displacements that are very important. And another element that is linked to the Bureau de Taxi, they thought of a very good idea that of installing an ecological mobile with dry vapor decontamination unit. So, things are very innovative. So for that, it's summarized to these two elements. As Dr. Drouin talked to us about the information that I believe all Montrealers wanted and needed to hear. I will say a few words in English, and then we'll be able to go to the question period.
I'm glad to be here. I want to join my voice to Dr. Drouin, and I want to thank all the people working in the health network. You're doing an amazing job. Thank you for being there for us, here for us, and same thing for your entire team, Dr. Drouin. Just a few words about the robocall, automatic calls that we will be doing to reach our seniors. I think it is important that if you are a senior listening, or if you're maybe a member of the family and you have a senior around you, I want you to know that if you receive a call at the beginning, it says that it's from the public health authorities and the City of Montreal, it is safe. It is not phishing, and it is important to listen the entire message to find out about the various resources that are available. And this is why we're putting this call together to be able to direct seniors and most vulnerable people to resources that already exist. So those calls are safe. I wanted to say that. And finally, the last thing I wanted to say is regarding the Bureau du Taxi. Because the taxi drivers are doing also a great job in making sure that people can do safe movements as they're doing their essential movements. Maybe it's going to work, maybe it's going to an appointment at a doctor, and whatever it is, we decided to offer a subsidy to the Bureau du Taxi in Montreal of $260,000. It is a financial assistance. It will be, of course, the Bureau du Taxi that will handle the money. And this grant is offered, first of all, to create a better installation of protective barriers between the driver and clients. So this way people feel better protected, and same thing for the workers, for the driver. So it will definitely support the Bureau, the different taxis to be safer. There will also be more sanitary products available for both drivers and clients. And finally, I think it shows how it is important to offer mobility options for everyone depending on their own situation. And I'm very proud that we're able to support all those different sectors of activities. Thank you.
Merci, Madame Plante. On va passer à la période de...
We will now go to the question period, starting with the journalists who are present here with us over the phone.
Par le journaliste du Journal de Montréal, Dominique Cambron-Goulet. Je réitère.
I would like to repeat, we really ask journalists to keep to 2 questions to allow everyone to be able to ask their questions. Yes, hello, Dr. Drouin, Madame Plante. I was wondering, there's a doctor who died, who resided in Montreal, who was 44. I was wondering whether you have any details on that case. Was that person infected in their place of work? Well, I think that Dr. Ruda has said it often, and I hope that all media will keep that in mind. We do not comment individual cases. These are confidential data, and in no moment do we give out that data, whether to our partners and less to the media. So I wish to reiterate that, and I'm telling the population, because your data are confidential when they are in the hands of public health. Well, we know that there was a person in their 30s who died in Montreal. So that person is relatively young. How many people below 60 years of age have died in Montreal? Usually, when we have small numbers in public health, we do not reveal them. So if we haven't given you a percentage, it's because it's less than 5. Thank you.
Nous allons passer maintenant à Daphne Cameron de La Presse. Daphne.
Yes? Can you hear me? In your presentation, you said that we had reached the peak in Montreal. Could you give some more details on that? Because we had the impression that the situation is not under control in CHSLDs. So what makes you say that? The epidemic curve is something that we look at in a populational perspective. So of course we'll always have a growth up until next year in the number of cases, because the population doesn't have immunity, and we're probably below 3-4% of immunity in the population. When we talk about the present population curve, we were expecting by the end of last week to start reaching the plateau, and that is what I had announced to you. So the number of new cases, so acquired in the community, reaches a certain plateau. Of course, right now, we can no longer base ourselves a lot to our new cases data to extrapolate what is going on in the population, because, we've changed our screening criteria, amongst other things, because of issues of priority having to do with the capacity that we have. So we've gone a lot to CHSLDs, healthcare workers, certain essential workers, and places where there are outbreaks. So of course, it falsifies some of the data. What we're looking at, and that is why today I was presenting to you the elements of incident in hospitalizations and admissions either at the hospital or in the ICU. These are indicators that are a lot more reliable to allow us to estimate that populational epidemic peak, which is for serious cases. So it's a lot more stable as an indicator, and it doesn't depend on our screening criteria. And the peak of hospitalizations or deaths, usually when we reach the epidemic peak, about 10 to 12 days afterward, we reach the hospitalization peak, and a bit further, we reach the death toll peak. But of course, in CHSLDs, these are curves that are almost independent of the populational curve, because these are outbreaks in living environments. So what is going on in the community in terms of community transmission is a little bit right now not falsified, but the situation in CHSLDs is it falsifies our numbers a little. And we're still confident that as far as community transmission for the first wave, I'm not saying that there won't be others, but we hope that it may be small if we get one in the next few months. But for the first wave, we consider that we have reached a plateau.
OK. Alors, on va passer
So,
à François Carabin,
next question.
du journal Métro. François Carabin, la parole est à vous.
Oui, bonjour.
Hello.
Bien aussi.
Can you hear me? Yes.
Merci. Bonjour, Madame Plante. Bonjour, Dr. Drouin. Ma première question s'adresse.
My first question is for Dr. Drouin.
Depuis quelques temps,
For the past little while, you've been showing us a portrait of the spread of the virus per neighborhood, per borough in Montreal. As far as the CHSLDs are concerned, with the information that was given to us by the government the day before yesterday, I would like to see certain numbers. In Centre-Sud, there's over 400 cases. In the West, over 300 cases. Same thing. The interpreter missed that next sector. Are there sectors of the city of Montreal that worry you more than others as far as CHSLDs are concerned? And what explains that prevalence of cases in those sectors? I do not believe that there are sectors more affected than others. There are CHSLDs for which there were outbreaks at the very beginning that are starting to get out of it, or at the very least to control the situations. There are others, according to the measures that were set up. There's also, the setup. The very setup of CHSLDs does not ease. It's not like in hospitals where you have hot zones and cold zones, and it's really, pretty systematic. And these are things that they do often. So we had to change the setup. It's very variable from one CHSLD to another. And right now what we're looking at, and we'll ask you to be patient, the media, I mean, because we are rebuilding and resetting up these data to look at the differences in terms of one place to the next, and how we can, in certain CHSLDs, emit measures and control that virus, which we are learning to get to know as well. It's not like H1N1, it's not like a gastroenteritis outbreak, which we manage every year in CHSLDs. We realize that this virus probably has different behavior. So right now, I do not have the answer to your question. And as we said earlier on, we are trying to create, make inquiries at the same time and investigate at the same time as we're trying to put out fires. So, and sometimes, it's like when you have a firefighter who's trying to decide, when they see a fire, when they're putting out a fire, they don't know whether it was caused by something burning in the kitchen or by somebody smoking in their bed. So we're asking you to let us have the time to really be able to collect that information correctly and get to the correct conclusions.
Merci. Pour ma deuxième question, encore une fois, pour
my second question.
Pourrait prendre un peu plus longtemps pour les proches aidants.
Something about taking time longer for caregivers. Unclear question. Premier Legault and Ms. McCann made a general call throughout the province to be able to help in CHSLDs. The rest of the staff, do you think that it will be able to be quicker? Partial question. Some of it was missed. Well, I was with the management teams of all 5 CUs, and it is that file that we were looking at, that is the integration of caregivers. And the decision of taking a few days before being able to think of integrating them was the managers who were saying that right now they are so busy integrating new staff coming from hospitals and other sectors that I think that when we hear them in the present days, their priority is to integrate that new staff. And as soon as it is well organized, and there will be, of course, the entire operation having to do with caregivers. Thank you. Can you hear me? Yes.
Oui, désolée. Donc c'est ça. En fait, on se demandait, vous avez évoqué, Madame Plante.
You talked, Madame Plante, the question of parks last week, that there were a lot of people that went to parks and it had to be avoided as we speak. What is the situation right now in the parks? Well, concerning the parks, I would say that the situation is pretty much under control. Police presence that we did broadcast to, that we did send to all parks. There were more police officers in certain bigger parks, for example, the Canal La Chine, Old Montreal, Mont-Royal, or at least the Old Port area, Parc La Fontaine, places where there's a greater level of density. But there were also police officers in local parks and neighborhood parks, and it contributed quite a bit, I would say, to improving the situation. But I still wish to say that, generally speaking, even when there were a lot of people in parks, the population really tried to respect the 2 meters. We feel that willingness. We're not, minimizing it, but we have to, of course, encourage, people to go into their neighborhood parks and not to go, to a different place to go walk. We really want to restrain, people moving around too much. So when you go out for a walk to get some fresh air, do it in a neighborhood park. Your neighborhood park. A second question. We're talking about caregivers that could come and help out in CHSLDs. Do we have enough material to make sure that they will be able to help out in safe conditions with gloves and everything? That is the very reason why in this preparation it requires that these people be trained, that we have the material, that the consent be informed, the people who decide to go, and that we make a risk analysis for each establishment to know whether the conditions allow for a safe integration. So the aspect of the materials is part of those necessary frameworks. So that is what is perhaps also delaying things, because we do have to prepare all of these elements. So, but the material is available? Well, of course the material is available, but it's going to depend on the quantity of caregivers that we, welcome as well. All of that has to be calculated, but I do not believe that today as we speak that all of these calculations have been made, because right now the priority is to integrate new health staff. Now the questions that were sent to us by email, and then in French, and we'll come back to English questions after. Ms. Drouin, last week you said that Montreal would get to the peak of contamination curve within 3 days. The region has 451 new cases since yesterday. Is that to say that the peak has not yet been reached? How to explain that? Well, I think I already explained it during my speech at the beginning. So over 200 of these cases out of those 451 are cases that we call with epidemiological links. So people who had no lab tests were probably family members of people who had received a COVID positive and who within the 14 days, develop symptoms, because we do follow these people, make a follow-up every day. So those people had already been investigated but were already isolated. So the transmission chain had been broken. So we integrated them in the system because the definitions of our surveillance system, we decided to integrate those cases and consider them as being confirmed cases, even though they don't have a confirmed lab result. Ms. Plante, the mayor of Quebec, said that he did not think that it was possible to go back to school this school year. What do you think about it for the Montreal students? Well, listen, I share some of the worries and concerns that were mentioned by the mayor of Quebec, and I think that these are concerns that are very, very much the case right now. We have to find a balance between going back to normal while following the rules of public health. So for me, as of now, I go back to the decision, and I will base myself on the decisions that will be taken by the government of Quebec as well as by the public health authorities at the national level. The question asked by Radio-Canada: when will non-essential businesses be able to reopen in Montreal? Right now, the provincial government is having a look at the deconfinement strategy at the level of the entire province. And we in Montreal, because of our specific situation, we are looking at the modulations which will be necessary because of the density, the risk, and the first wave, which hit us more. So today it's pretty difficult to give a date and to be able to look at what the sequencing will be. But of course, the services that we've kept are the essential services, and the following services will also be services, that will be looking according to priorities, as well as our capacity in certain services of maintaining social distancing, as well as safe practices in order to be able to reopen these areas. So that is quite the exercise that is ongoing to identify the sectors that will be opening first and those that will perhaps have to open more belatedly. So restaurants and bars, should they expect to be closed until June, July, the entire summer? I cannot confirm anything. But of course, a bar is a place of gathering where there's a lot of proximity, contacts, and it's very difficult to maintain distancing. So clearly, logically, you'll probably be able to know that it's not going to be amongst the first places that will reopen. And I would like to add to what Dr. Drouin just said. Although we understand the interest to reopen certain businesses and others, I think it's important to know that whether it is on the public health side or the city side of the metropolitan area, what we want is to really bring together the winning conditions so that the deconfinement is safe. That is truly what we're working on. So we're working on how that's going to take place. We will now be going to English questions over the phone.
Simon Nakonechny de CBC. Monsieur Nakonechny, c'est à vous.
Hello, can you hear me?
Absolutely.
Yes.
Hello? Okay. We've heard that at least two CSUs have told caregivers they weren't ready or organized for them to start helping out in CSHLVs. Are you getting enough warning from the provincial government for these changes in practices? And I guess why are the CSUs not ready to accept the help from caregivers?
It's not that they're not ready. They have to prepare. The announce was made on Wednesday for today. So it is not that they're not ready. They're ready normally to with their healthcare workers, but to prepare the introduction of caregiver, they have to make sure that it's only in cold zone. We have to make sure that there is training. We have to have staff that will welcome those caregiver and they give them the instruction. And we are short of staff, so we can imagine that if we have to add one more person in each CHSLD to welcome and to prepare those persons, we have to hire them. We have to make sure that we have the protective, the equipment. So this is the preparation that cannot be done in 12 hours. So right now the priority is to introduce new healthcare workers, but as soon as this operation is well done and works well, the CIUS are going to introduce the caregiver. And I think it's we all want them to help us. It's just that we have to do the things properly and to make sure that it's done with security.
Deuxième question.
And second question, we've seen the cases in Montreal North rising over the past week. It's now third in total number of cases and third in cases per 100,000 on the island. What is happening there?
Maybe I'll have to look more closely, but mostly what we are seeing in the increases that we're seeing are mostly attributed to the outbreaks that we're seeing in CHSLD and not necessarily to community transmission. So this is one thing, and the data that we're presenting with the cases, we have to be really careful in using those data because with the changes that we've made in our criterias of screening criterias, we're a little bit introducing a difficulty to interpret the community transmission.
Question maintenant pour Andrew Brennan de CTV. Andrew.
Hi. A bit of a follow-up to what was asked before, but with caregivers saying that it seems like they're in a bit of a catch-22. They're trying to show that the residences are saying they need to prove that they are not going to bring in the virus by testing negative at a testing site, but testing sites will not test them unless they have symptoms. So it seems that they are unable to show or indicate that they are not going to be bringing in the coronavirus into these facilities where there's vulnerable people. So as much as there's an issue with ensuring that they're being trained when they get in there, so they're putting on PPE equipment or protection equipment properly, there's just a question of how they can even show that they have the bona fides to be able to get in the door. So how do we solve this problem?
I have a solution. No. The criteria for admissions of caregivers, we won't have the test won't be one of the criteria. So and those are in the protocol that has been sent by the government yesterday. So of course, the caregivers should not have symptoms, should not have been in contact with someone that has COVID. So we have different kind of criteria, and they have to, each time they come in, they have to make sure that they're still asymptomatic. And of course, if they develop symptoms, they will get tested and they won't be admitted anymore in the CHSLD. But the test will not be a criteria to admit a caregiver. What is important is that they have the equipment to protect themselves and protect the elder they're going to give care to.
Autre question?
Okay, thank you.
OK. Il me reste deux journalistes. Premièrement, Mary.
We have two journalists left. Marion Scott from the Gazette first.
Alors, je vais poser les questions pour elle. Ça s'adresse à Dr. Drouin.
So we'll ask the questions for her.
The government promised that all healthcare workers and residents of CHSLDs would be tested. Now we are hearing from families that workers have not been yet tested. Also, some workers are working both in hot spots and in cold spots, which creates worries over whether they are spreading the virus or not. Why haven't they been tested yet, and when is this going to happen?
But I do not have the specific answer for specific sites, but the recommendation that we gave last week after the Prime Minister announced that Madame McCann announced that the CHSLD would be tested, we gave the priority to the healthcare workers, because when we have an outbreak on a unit, it is not recommended to test everyone. So the priority was to healthcare worker. We know that in some CIUS there has been an operation to test healthcare workers, and some have put the operation on a week or a week and a half because we have a limited capacity of tests for each day. So we have to put them, but it is our recommendation that healthcare workers working in CHSLD be tested.
Deuxième question de Marion Scott. Montreal continues to be the epicenter of COVID-19 in Canada. Why do you think, Dr. Drouin, this is the case, and why is it still the case despite all the measures that have been taken to combat the virus?
There's a lot of factors and hypotheses to
It's a hard one.
Yeah, it's a hard one. To explain this, as we said, we had the semaine de relâche, spring break. The spring break, people have traveled a lot. That's not what we've seen in BC or in Ontario, where their spring break was coming after us. Of course, we have a link and proximity to New York. A lot of people have traveled there on spring break, but also we have commercial interaction in some communities that went to New York in February and March. And I think we have a different way of testing, a different capacity of testing. We have a surveillance system that is, I think, more I haven't seen the way they're counting the cases in other province, but when we saw it, when we had the heat wave, we have an ability to capture the cases and the deaths that maybe is not the same in other province. So sometimes it's difficult to compare. I think we've put the measures early. And as I said, the community transmission is slowing down, but what we're seeing is really the outbreaks in elders centers, and this is what is ça fait mal.
Okay. On termine avec Tim Sargent de Global. Tim, est-ce que vous êtes sur la ligne? Alors, je vais poser des questions pour vous. Dr. Drouin, why is Montreal's CUSIS not releasing the numbers of deaths in CHSLDs? On en a parlé auparavant, mais...
The system, we're putting in place our surveillance system. It is a complex. If you're in a small region and you have only 3 or 4 CHSLD, it's easy to connect the data and the surveillance systems. In Montreal, we have hundreds and hundreds of CHSLD, RPA, and other types of residency. So we're working to put this all together and to give you the best numbers, the more accurate number we can. It will come.
Et dernière question de Tim Sargent.
Last question from Tim Sargent.
Care workers are bringing the virus into CHSLDs. Are they still doing contact tracing in CHSLDs?
I think one thing we have to understand is I think healthcare worker did bring the virus in the CHSLD and brought it before we had recommendations for EPIs everywhere. Right now, when someone works in a CHSLD or in a residency for elders, if you give care, you have to put, even if you're in if you're in the hot zone, you have more protection. But if you're even in a cold zone, you have the protection. So we shouldn't have transmission if the precautions are in place. And of course, by testing the healthcare workers, we're seeing that we have a lot of asymptomatic healthcare workers that test positive. So of course, it reinforced the necessity to put the mask and all the protective equipment.
Merci beaucoup tout le monde. C'est ce qui conclut notre...
Thank you, everyone. This concludes our press conference for today. Thank you.